How are you applying design techniques to solve problems working with UNICEF on mobile health solutions in Africa?
So design by nature is a problem-solving discipline. You have a problem or an objective that you want to hit, and you need to learn about that problem and get some context around it to solve it, to make a thing, a product, a service, anything, reorganize your company. And UNICEF and any NGO actually, all of their problems are really, they're worldly, wicked problems, but they're design problems. Any problem that has a foreseeable or even like conceptual solution is a design problem or a design challenge. So using the same approach that we would take to solve a problem for a client who needs like a new mobile application, of trying to learn what that mobile application should do, we would do the same thing in particular for this UNICEF project for community health workers. We know that they have access to technology. It's a tremendously impactful role. It's this volunteer role in more rural communities in Africa that's not paid, but it's a much needed supplement to official healthcare workers that are just few and far between in these areas. And the one thing that they do have access to is mobile technology. So how can we, without introducing anything that could be detrimental, leverage their enthusiasm, their power within the community and their desire to do good, and their access to this mobile technology to help people get healthcare, to help more, specifically in this case, mothers and children in rural Africa have access to consistent healthcare when they need it.
And how did that play out?
So we just did the beginning stages, and we came in at an interesting point in the project. UNICEF had already done these 2 amazing pilot programs. So we tagged along with the UNICEF Innovation team to help them evaluate those pilots, and also to learn a little bit more about the context. So learn more, they know a lot about the rural clinics and a lot about the healthcare system, but they knew a little bit less about kind of the cultural implications and the communities and some of the ingrained beliefs of the people that would be visiting these rural health clinics. And they knew less about the community health worker as a result, somebody who's a member of the community who interfaces sometimes with the healthcare system. So we came to get a little bit more of that context, hoping to scale these things, which is wonderful, and they're currently trying to find funding for it. And I think they're such cool solutions, they're going to do really well. So we wanted to make sure that we gave them a lot of kind of human considerations as they were scaling technologically to address. How do you, address the motivations of these CHWs? Are there ways that maybe aren't monetary that you can support them? And things like that for them to consider as they make this bigger. And then also as they move into other countries, just kind of points to consider, to learn a little bit more about before they implement these systems. And UNICEF's really in an amazing place where they're trying to, they brought Frog on as a partner because they're trying to establish this design thinking, so more of a kind of user-centered process throughout their organization. And this was kind of the first step of that. So we gave them, as a result of this really baby initial effort, some artifacts that were like visually describing processes and some concept diagrams of the CHW and their important role between like the community and the healthcare system. So things that they could socialize so that everybody can get aligned around this common image of this role. And hopefully use that to build future kind of products, future initiatives, and to realize that these kind of components that we're calling out here are things that they need to understand and address in different markets because they're not always going to be the same. So just starting to get them thinking about that, and it's more of right now it's more of an alignment tool, and then help for these specific pilots to scale more thoughtfully.